Hi, my name is Alicia Cisne. I'm a Maryville nursing nurse practitioner student, and this will be my head, ears, eyes, nose, and throat video for nursing 612. This is Andy. He's going to be my patient, and he's 37 years old. So I'm going to first start by inspecting your head, and I notice that it is symmetrical. Your hair is thick and full. It's not coarse or dry. I see no lesions, not any acne. Everything feels fine. I don't feel any bumps. I don't notice any bruises or anything. Next, I'm going to go and palpate your sinuses. Let me know if that hurts you at all. It's like frontal and maxillary sinuses. And so next, I'm going to go for the eyes. Right off the bat, I noticed that the sclera are white, the irises are round. I'm going to pull them down. His conjunctiva are pink. Don't notice any erythema, any swelling around the eyes or anything like that. Have you had any double vision or blurred vision recently?
No.
Do you wear glasses or contacts?
No.
Okay. So the next thing I'm going to do is check for reflexes on his eye. First you check the right eye, and then I'll be looking at the left eye, and then I'll do the opposite. Then next we'll be doing pulling it down and looking at the conjunctiva. Can you look up into your nose and up into the other side? Same thing, up your nose, up to the other side. Up into the nose, up into the other side. One more time. Thank you. And first off, we'll go and do your cardinal visions of field. So watch my finger with your eyes. Please don't move your head. So we're going to go to the side and up and down and across the center and up and down back to the center and then accommodation. Good. That's equal. Let me know whenever you don't see my fingers anymore. We're going to be testing your peripheral vision. Good. And then we're going to look in your eye. The first thing we'll do with this is we'll look for a red reflex. And then maybe a little closer and dial until I see the, look straight at me. We'll see the inner part of the eye with the lens, and notice that he's got no white puffy spots, not a lot of edema, and that his vasculature is normal. And we're going to do the same thing. I can't help it. Do the same thing with the other eye. Just look straight ahead, please. And the red reflex is normal. And we're going to look at the lens, up and to left and down. Everything looks normal on that side too. Next, we're going to go to the ears, and with his ears, they're symmetrical. They're equal with the tops of his eyes. Is there any tenderness when I palpate?
No.
His mastoid's not swollen. No tenderness around the ear. Have you been having any tinnitus, which is ringing in the ears, or any problems with hearing recently?
No.
Okay. And look in the ears. You don't see a lot of exudate, good cilia. His tympanic membrane is a pearly gray and has good cone of light on that side. To the other side. The cilia is normal. There's no cerumen. Good tympanic membrane with an also normal cone of light noted. But did that hurt at all whenever I was looking in your ear? Good. And now we're going to perform the whisper test. So I'm going to close this ear and I'm going to whisper a word and I want you to repeat it. Can you just look straight ahead for me? Okay.
Basketball.
And then on this side, baseball.
Baseball.
Good. And then we're going to, this is called the Weber test. I'm going to put this on top of your head and it's going to test equal hearing on both sides. Please let me know if you hear it on both sides or if it's just one side mainly.
I think I hear it on both sides.
Okay.
I feel like I do.
Okay. So then we're going to do the Renee test on this side. And what I'll do is this is going to be testing bone conduction versus air conduction. So I'm going to start off and we'll put it on your mastoid bone. Let me know when you don't hear that anymore. And then I'm going to turn it around and then let me know when you don't hear it in front of your ear anymore.
And I can hear it. Now I cannot hear it. I can't hear that.
We'll try that again.
Okay, I cannot hear it. I can hear that.
Just let me know when you don't hear it. So that was a normal finding in his left ear that air conduction is supposed to be twice as long as bone conduction. We're going to do the same thing on this side.
Okay, I can hear it. Okay, I cannot hear it.
Okay, so we're actually going to go back to the eyes for a minute, and we're going to do a cover-uncover test, and I'm going to watch for accommodation. So if you'll just look straight ahead, I'm going to cover at my nose. I'm going to cover your eye, and I'm watching the right side to see if it drifts or anything, and I'm going to watch the left whenever I uncover, making sure there's no drifting or changing in accommodation. We'll do the same thing with the left eye while I'm watching the right. Now I'm watching the left. And before we started this, we did the Snellen E chart where his vision was 20/20 and left, right, and both. And then the Rosenbaum, which you keep about 14 inches from your face, and it was 20/20 there also, without glasses or contacts. And then next I'm going to go ahead and look at your nose. So I notice it's symmetrical. Have you been having any runny nose, any problems smelling,
No.
anything like that? There's no redness around the nose, no discharge that is noted outside, no unsymmetry. It looks pretty normal. And then we're going to go ahead and look up. Can you look up for me? I'm looking in the left nostril first. I see good cilia. The septum is midline. There's no discharge at all noted. This side has a little bit of urethra, but not terrible. Looks good. And can you, I'm going to include this side, can you sniff in? And other side. Good. It sounds like this side's a little more occluded. Have you been having some congestion here lately?
In the mornings.
In the mornings. Okay.
They went dark.
And then we're going to go ahead and look at your mouth. Have you been having any sores, any pain anywhere like that in your mouth?
No.
No? Okay. So if you'll just open for me, first thing I'm going to do is this one. Look in your mouth, go ah, and push your tongue up into one side for me, and then to the other. Good. Teeth are perfect, very white and pearly. I see no problems with dentation at all, no cavities, no swelling. His mucosa is pink and moist, and then I'm going to use the tongue depressor, and I'm going to look back at the back of your throat. We're going to check out the uvula and the tonsils. Say ah. Uvula is midline. Tonsils are at a 0. There's no erythema or swelling. And now I'm going to elicit your gag reflex, okay?
Okay.
That's a good gag reflex there. Okay, so the last thing I'm going to do is check out your throat. First thing I want to do is feel for any swelling in any lymph nodes. We're going to be checking behind the ear, underneath the jaw. Good. In the sinus area.
Should have saved the gag reflex for last.
Sorry. Down your throat. Towards the back. And I don't feel any swollen lymph nodes. Have you been having any trouble with your throat at all?
No.
Okay, so we're going to check the thyroid now. You can feel it there. And can you swallow for me? Good. And we're going to check the other side. And can you swallow for me? Good. No swelling, pain. I didn't feel any swollen lymph nodes or anything. And one more thing, I'm going to grab my stethoscope, and we're going to listen to your thyroid. Make sure we don't hear any bruise. And then we actually do your good. And that concludes our video. Thank you.